So I'm going to start recording now. So first, does anyone have any questions? What you can do, you can either type your question or you can raise your hand and I'll turn your microphone on. And then we will see. So anybody got any questions? I'll have a minute or two first, take any particular questions you might have. If not, I'm going to get straight on to the letters. I've got 5. I think it's 5. I don't know who wrote them. I just copied them off of Google Docs. So I don't know anybody. No questions, right? Then so I'm not going to waste any more time. Let's get on with this. Okay. So let me just sort this out. I'll put the chat box over here if anybody's got any questions. Okay. Dr. B. White. Me? I suppose that means Mr. Right, let me save the changes and we'll see what we've got here. I'm writing to request your assessment, including an MRI, because MRI is countable, and advice regarding the possibility of surgery for Mr. Pollis, whose features are consistent with low back pain with radiculopathy. Okay, that's not bad. It's a clear introduction. You want me to assess the patient and give him an MRI and advise about the possibility of surgery. Okay, Mr. Pollis presented, should be capital. Mr. Pollis presented with a 2-day history of sudden severe lower back pain, which occurred at home while lifting. Right. Okay. Now, I think there's too much detail here. Let me just check the word count. Quickly check it and see what we've got here. 236. Okay, that's not bad. A little bit long. I see someone has asked a question. I'll comment on that afterwards. Right. So I don't really know if we need all this. Do we really need, the exact weight of the logs into the barrow? Maybe not. So you could maybe leave this out, or simply say sudden severe lower back pain which occurred while lifting weights or gardening or something. Yeah. The pain made mobility difficult, and he was aided back into the house. Again, it was a bit too, I don't know, I think it was too much detail. I don't think you would actually put all this detail down in a letter. So, you would probably say something like he injured himself in the garden while lifting heavy weights. His pain has made him immobile or has made mobility difficult. I don't really need to know who aided him back into the house. Okay. As a result of this, he took Panadine Forte, which had an effect, because effect is a noun, which had an effect on the pains. He could walk around the house without help. So, right, now we've got this very short sentence here. His examinations were unremarkable. So upon examination, right. So you've said his examinations were unremarkable. However, when you examined the spine, it was remarkable in that there was pain on flexion and extension. So this seems somewhat of a contradiction. Oh, his examinations were unremarkable. However, when I examined this particular part, there was something that was remarkable. So I don't think we need, right, so this is 236 words. Now, there's not automatically a penalty for going over the recommendation for the word count, which is, 180 to 200. 180, as I've seen, is usually a little bit short because, to like completely fill the narrative the story. I think 180 words sometimes can be a little bit short. 200-ish is better. This is 236. But we can see here there's a little bit of detail which probably you don't really need. The exact weight of the logs, his wife helped him into the house. Okay. However, on the examination of the lumbar spine, there was pain. Consequently, was advised to rest on paracetamol was prescribed. Please note he's allergic to caffeine and a contrast agent. So, right, we've got a bit of a mixing information within a paragraph. Okay, so usually a paragraph, it's like there's like 3 stages, 3 components. The patient came, the patient said, what you found, what you did. Now that has a logic. So the patient comes and says, oh, doc, I've got this like pain, blah, 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 blah. You take a look, you make some assessments, you make a diagnosis, and you take some action. Okay, that's, that would be a logical construction of a paragraph in terms of the visit, yeah? So when you're jumping around here, and the stuff like he's allergic to, so, okay, so his examinations, pain, advice to rest, oh, and please, no. So I wouldn't put this sentence here, because, I would maybe put it like in history, or I think actually that might be better at the end, because this is when you're asking about, an MRI. Yeah. So I think this would work better if we took it out of this visit paragraph and we put it somewhere down here. In view of the above, your assessment, blah, blah, blah. Please note he's allergic to the contrast agents. Now that would make more sense if it were here. Yeah. Okay. 5 days later, he presented with worsening symptoms. What did you do? What action did you take? So if it's a visit, patient comes, oh, doc, I'm in a pain, blah, blah, blah. What did you find? What did you do? So here, the patient just like came and says, oh, this pain's getting worse, but what did you do? Did you just say, oh dear, come back in a week? Didn't you take some action? Okay. Today, he presented with deteriorating symptoms, including tingling sensation on the right calf. Isn't it in the right calf? Okay, deteriorating symptoms, including a tingling sensation, right? Okay, a tingling sensation in the right calf, as well as, instead of and, because and, I would probably say as well as difficulty mobilizing. On examination, light touch sensation was absent on the lateral distal calf. Movements were restricted by pain, and his movements, or whatever movements, were restricted by pain. In view of the above, your assessment would be highly appreciated. I think possibly appreciated. But why would it be highly appreciated? Why do people keep using this adverb and this expression? If you look at model sample answers from providers, Swoosh, E2, etc., not one of them uses this expression. Not one of them. And no one has been able to find me a sample by Swoosh or E2 that says anything about etc., etc., would be highly appreciated. So, when I say it doesn't really mean anything, would be highly appreciated. By whom? By the patient, yes. Appreciated by you? And why would it be highly? Why, some people sometimes, instead of highly, make it kindly. Why would you do it kindly? Would they not automatically do it? I mean, as opposed to what? Unkindly? Anyway, so try to avoid these adverbs because it's essentially, it's meaningless. So all I would say is I will put this somewhere down here because it makes sense here, yeah? Okay. So apart from that, not too bad. Let's see what we've got next. Mrs. Clarke, writing to request your additional examination and intervention, including a bronchoscopy alongside a biopsy. Why not just say a bronchoscopy and a biopsy of Mrs. Clarke, whose clinical features are suggestive of bronchogenic carcinoma? Oh dear. Initially, Mrs. Clarke visited my surgery on the 4th, blah, 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 complaining of symptoms consistent with an upper respiratory, for which I prescribed her penicillin. You don't need a preposition there. So you can commence someone on, or you can prescribe something, but you don't need a preposition with prescription. I prescribed her penicillin, I prescribed him analgesics, etc. Please note that, well, you don't really need that. Just say, regarding her social history, she has been smoking every day since she was 30 years old. Also worth mentioning that she has a family history of laryngeal carcinoma, along with also with mining. Well, yeah, but I mean, that is nothing to do, that's not genetic. Lung disorder, such as what? Emphysema, etc. That's because he was a coal miner. That's not hereditary. So I probably wouldn't include that there. I would mention the laryngeal carcinoma, but maybe not the disorder associated with mining, because that's not inheritable. It's not a genetic, it's an occupational illness. Okay, today Mrs. Clarke presented me with a complaint. So she came and said, "Oh, doctor, here's a complaint." No, presented with a complaint of coughing without secretion and blood. Right. Now, she wouldn't come and say, "I'm coughing without a secretion or blood." She would simply say, "I have a cough." However, the cough did not have, so, you know, how this is written here, it says she actually came with the complaint of coughing without secretion and blood. She would say, "Doctor, I have a terrible cough." And then you would ask her, "Can you describe it? Is it dry? Is it wet, blah, blah, blah?" And she'd say, "It's dry." So having this information here, it sounds like she actually said, "I'm coughing without secretion and blood," but that's not true. She would have to do something like, she presented with a complaint of coughing. However, when questioned, she mentioned that there was no blood secretion or etc. Okay. The last 7 weeks, so we need to get rid of one of those E's. Although the other complaints had improved with antibiotics. Other complaints, is that the upper respiratory tract infection, I suppose. She also reported the symptoms of chest stiffness accompanied by breathlessness, which was significant. Well, it's significant if it happens in the daytime or in the nighttime. Which was pronounced in the evenings, as in it was stronger, because that doesn't quite work. So you would probably say pronounced. So in other words, it was worse or stronger in the evening. Upon examination, nothing was remarkable except for a monophonic wheezing, which was auscultated in middle of the night long with supports consolidation. Laboratory result reveals normal sputum microscopy. Chest radiology, signs of right lung cancer. Therefore, I'm referring this patient into your care. Okay, that seems a little bit right. Now, we don't really need this because it doesn't make a lot of sense. Therefore, and you basically say the same thing here, So we don't really, so I would eliminate that, okay, and then say, based on these findings, blah, 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 I believe Mrs. Clarke requires your further, etc., etc., if you deem appropriate. Endoscopy in addition to historical would be appreciated. Now, that's better. So we don't need that because you basically say the same thing again. Okay, not too bad. Not too bad. Let me see, what do we have here? Mrs. Sally Fletcher. To request what? We have a verb, but what is it that you are requesting? Do you mean refer? If you mean request, what is it you want the reader to do? I'm writing to request your administration, what, your management? So that doesn't make sense. Who is being discharged today back to your care after recovering from laparoscopic surgery due to endometriosis. Mrs. Fletcher was referred to the hospital with complaints of periodic acute menstrual pain. I think is it menstrual? That's spelled right. Menstrual pain. However, as soon as she arrived into hospital, I confirmed the diagnosis by conducting transvaginal ultrasound and actually the cyst likely to have endometrial origin. Okay. On the 25th, Mrs. Fletcher underwent. Now, surgery is uncountable in general, but an operation, a particular operation, is countable. So we need an article. Underwent an uneventful laparoscopic operation. She was advised to keep the incision clean and dry and was allowed to shower from the following day. Additionally, the patient was encouraged to return regular diets, blah, blah, and be elated as per her tolerance. Therefore, Mrs. Fletcher was discharged after having asatisfactory audit tests results. Well, right, so we've got a singular article. Tests are plural, results are plural. So we don't need that plural there. So test results, the results that can be plural, and we don't need the article. After having satisfactory ordered test results, well, I suppose they were ordered. They weren't just conducted randomly by some nurse or doctor wandering around in the hospital. So we don't really need to say this. Just simply say, after having satisfactory test results, namely HET, etc., etc. Now, this is a long sentence. This is nearly a run-on sentence. So, therefore, Mrs. Fletcher was discharged after having satisfactory test results, namely HET, as well as after assessing her bowel. Now, so after assessing her bowel and bladder, I would probably make this passive, as well as after having her bowel and bladder condition assessed. Also, the orientation level and were not. So this is a bit confusing here. We've got some prepositions, we've got some verbs, we've got a mixture of active and passive. I'm not really sure. Well, I can tell, but to the casual read, in terms of grammar, it's not as clear as it could be what happened when. So she was discharged after having satisfactory test results, as well as after assessing. So why is this a continuous verb? After having, so she had, but after assessing, who assessed her? So if you got a continuous verb here, it reads like she assessed her bowel and bladder. Now, in terms of parallel structure, having a possessive, but here it's causative. So, someone performed the action, but here after assessing. So That's not a causative. It's a symbol, present participle. So who performed this? So to make this make sense, I would make this a passive. So as well as having her bowel and bladder condition assessed, or her bowel and bladder condition and orientation level assessed, etc., she was permitted. Well, isn't it? She is permitted, or she was advised to refrain from sexual activity for 2 weeks. So, okay, she's permitted to return to her sexual activity after 2 weeks. Please note she's on analgesics and can only resume to drive. You mean resume driving? Why is that 2 plus infinitive? Alternative tells its final dose. Any queries, do not hesitate. Okay. So that sentence is a little bit confusing. It just needs a bit of work there. But apart from that, that's not bad. Okay. Mr. Walker, I'd like to request your assessment, possible prostate biopsy, and a correspondence. Why is that me? Me? I suppose you mean Mr. What's a correspondence? A biopsy, I understand, and a correspondence. What does that mean? Can somebody type something in the chat and tell me what that means? Is this a technical term, a correspondence? Because as I understand it in English as a word, a correspondence means when you write to someone and you exchange mail or letters. That's how I understand the term correspondence. Am I missing it here? Can somebody make a comment in the chat box? What does correspondence mean here? Is it a medical term which I'm not aware of? Can somebody tell me? Does anybody know? No? No what? What does that no actually mean, Khaled? What? No, it's not a special term, or what? It is not a special term. So a correspondence, so I don't know what that means then. I say a correspondence, right, yeah, right. So I just wondered if it was a medical term because I've never seen it here. Correspondence means, like say you were writing to somebody, like a colleague, and they wrote to you and you wrote back, blah, blah, blah. That is correspondence. So that's a nonsense. I don't know what that actually is. Okay. Says, okay, Mr. Walker's medical family social history. Sally 71 was diagnosed with prostate carcinoma, and the patient, right, well, I would put the patient first and his father at the end of the sentence, because we want to put the important person first, the actual patient. So why does it say medical family and social history? That's quite a lot of history. Regarding Mr. Walker's social history, because, well, yeah, I just say that Mr. Walker smokes excessively or has been a long-term smoker. Please note his father, etc. Was diagnosed with prostate carcinoma, and the patient smokes excessively at a rate of 20 cigarettes per day. On the 9th, Mr. Walker was sent to my surgery for a routine clinical checkup. Upon examination, no anomaly was noted. However, based on findings of prostate cancer, associated risk factor of excessive smoking, that's good. I requested for Well, you don't need that. Now, you can make a request for, but you can't request it for. We don't need a preposition with regular past tense verbs, okay? So you could say, I made a request for, or here, I requested. Urine analysis, which was normal, and prostate specific antigens for review in the next bit. Right, this is one sentence. That's too long. This is one sentence. All this, one sentence. It's a paragraph. That's too long. You need to break it down. This is certainly what you would call a run-on sentence. Normally was no. Yeah. So I'm not going to rewrite that. Can't be bothered. But that's too long. That's a single sentence. That needs to be changed. For review, well, for review to be reviewed, it doesn't matter if it's active or passive. I would probably say for review in the next visit, and counselled the patient on smoking cessation. Okay, so it's a particular patient. You need a definite article. Yesterday, the patient, well, I would have put his name, Mr. Walker, presented with complaints of discomfort while urinating, although he has made an appreciable improvement in cigarette smoking, reduction I would say in reducing his cigarette smoking or cigarette consumption to about 10 per day. On digital rectal examination, a hardening and enlargement of the prostate was noted. Available prostate-specific antigen result. Well, if it's a particular one, I put an article, the available prostate-specific antigen result was elevated at 10 ng. Based on his recent findings, I counsel, oops, 10 minutes left. Oh, get off, come back, right. I counselled the patient. Now, why do you keep missing articles? The patient on the need for. So I would have put his name here, Mr. Walker. Then you can use either he, him, or if you insist, the patient. In consideration of the above, in view of the above, that's the collocation. In view of the above, I am referring Mr. Walker to you and would appreciate feedback. It's not countable. Should you need further clarification, do not hesitate to contact me. Yours sincerely. Okay, not too bad. I'll just have time for this last one. What was that? His PSA results elevated. What does it say that? Well, it was elevated. I don't know. I mean, in English terms, yeah. It was elevated. Miss Grazia? Or is it Miss Garcia? Anyway, I'm writing to, I suppose this is supposed to be update. I'm going to update you regarding the condition of Miss Grazia, who presented to us with a or these. Right. So it's either a, as in singular countable diagnosis, or if it's a particular diagnosis, you could make it the, with the suspected diagnosis of meningitis. Your further follow-up care would be appreciated, well, I'm sure it would, but appreciated by whom? Miss Scratcher visit to me, right, so I put something like initially, or put the date. Right, on the 27th of blah, 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 initially Miss Scratcher visited me, or presented is better, complaining of headache, of having a headache, neck stiffness, photophobia, and a rash. On examination, although she was afebrile, particular rashes were noticed on her abdomen and legs. In addition, she was unable to touch her chin while lying, and her left arm was also bruised. Consequently, I ordered multiple blood tests along with a lumbar puncture, because you can count that. The blood test report showed leukocytosis and raised CRP, and the lumbar puncture report revealed reduced glucose and protein levels. Now, I put levels because you've got two, glucose and protein, so that makes plural. Subsequently, how do you spell that? Subsequently, yeah. Microscopy and culture what? Microscopy and culture tests, I suppose, confirmed the presence of something I'm not even going to try to pronounce. Okay, so is this a separate visit? Is this the same visit? I have no idea. Is this so? Oops, right, so this is why having dates is important. It helps to establish chronology. So Miss Grazia came to see you sometime, no idea when, complaining of this. She had some tests. So did she go away and she came back for a review? I don't know. Is this a second visit? Is it the same visit? Miss Grazia's features were consistent with. So is this, so, you know, this is, because we don't have any dates, it's very difficult for me to make any comment, because I don't know if this is the first visit, the second visit, etc. We're consistent with bacterial meningitis. Therefore, I commenced on empirical treatment, including ceftriaxone. Now, don't forget, if these are brand name drugs, they should be capitalized. I've no idea if they are. But if they are brand name drugs, they should be capitalized. However, she was changed to benzyl penicillin, 8 grams, every 4 hours or 5 days, on which report. Be grateful if you could contact her across family, friends, and counsel them regarding chemo prophylaxis and requirements, or the requirement of urgent medical attention in case of unknown illness, or in case of catching unknown illness. Please don't to contact me, any queries. Okay, so this was not very clear because they haven't put any dates. So I don't know when this happened or what happened, or was it the second visit or the first visit? Did she come and she stayed? I've got no idea. So that's not, contact. So it's not very clear, actually. Okay, right, I've got about 3 minutes left, which is not a long time. Right, so does anybody have any questions? If you do, now's the time. I can turn your microphone on, but you have to be quick. Only 3 minutes left before this Zoom session ends. It's only 40 minutes for free Zoom. I was meaning to upgrade. It's about, was it $15 or $16 to upgrade? And if nobody's paying me, I'm not doing it. So Khaled, let me turn your microphone on. Okay.
Good afternoon, Mr. Kevin.
Hello.
I think we have problem with verb to be, were and was. Yes, as her investigation was normal and her investigation was unremarkable. Apart from her her cholesterol level, مثلا, which was or which increased to.
Well, if it's in the past, then yeah, which was unremarkable, which was, yeah.
Yeah.
It's in the past. So if you can use that, that's perfectly fine. I mean, that's not a problem. Is there any specific example or sentence that you're not sure of? Because that's kind of a little bit vague for me to answer.
Example, as Mr. Garcia presented to me complaining of pain, which was radiated or which radiated.
Well, again, it depends, right? Radiated is obviously a simple past. So I would probably say which radiated. So again, there's more than one way to refer to the past. You can use past perfect, which had. So he presented to me complaining of pain which had radiated. So you could use the past perfect there. Also, it depends on the context. Now, it's not just about the context in the sentence, but the overall context and understanding in a paragraph. So while every sentence does not necessarily need to be grammatically strict, as long as somewhere in the sentence before it makes it clear when the past action occurred. So even if it doesn't strictly say in that particular sentence, it doesn't give you a definite time, but in the sentence before or in the context, you know when that past action occurred. It's kind of complicated to explain in just a couple of sentences. We would have to have a session on past tenses, I think. Oh, right, now this is going to finish in a second, because I say it's only 40 minutes, the free version. So what I'll do, I'll turn it off now because it's going to finish, and I'll be on Telegram for the next half hour or so to answer questions.